Good morning and welcome. I'm John Remillard, the president of the University of Vermont Health Network, Elizabethtown Community Hospital. Thank you for joining us here today on this very special occasion. The venue's a little bit different. We had hoped to have a large community celebration, but COVID prevents that. But this event is being live streamed on Facebook, so hopefully many will be able to participate and hear what's going on this very special occasion, which marks the establishment of a primary care practice on our new Ticonderoga campus. So I want to take a couple minutes and explain how we got to this point. In 2014, the board of directors of the Moses Ludington Hospital made a very bold and courageous decision. They decided that the old model of rural healthcare wasn't going to be sustainable in the future for this community. And change is hard, but they knew it had to happen. And that started a conversation and a planning process that went on for almost 2 years. And they invited important constituents to that table for a discussion. They had the University of Vermont, they had the New York State Department of Health, and they invited Hudson Headwaters. And the group together came up with a new vision for this campus and for rural healthcare. They decided that this campus needed to have a set of newly defined hospital services. It needed to maintain long-term care services, and it needed to maintain senior housing on this campus. And it also decided that we need to have primary care as a centerpiece up here. And that's what brings us here today, the establishment of a primary care practice to be operated by Hudson Headwaters. In terms of a quick review of the other items, the hospital services were redefined to include emergency medicine, outpatient services, which is lab, x-ray, rehab services, specialty services from visiting specialists from Plattsburgh or Burlington, and those have all happened. It happened mostly in 2018 when the Moses Ludington Hospital became a part officially of the University of Vermont Health Network. The long-term care services on the campus have continued under the operation of Elderwood, and the senior housing services continue under the direction of Liberty Affordable Housing. So that brings us to primary care. And at this point, I'm very pleased to introduce Dr. Tucker Slingerland, the president and CEO of Hudson Headwaters, to tell us about Hudson Headwaters and primary care coming to this campus. Tucker?
Thanks, John. It's with great excitement that we're here today in brand new space. It's really amazing what we've accomplished here. And I'd like to talk some more about that. But before I do, I also want to convey a deep thank you to the former Moses Ludington board, including Raleigh Allen, Bob Diedrich, Chatty Van Wert, who, like John said, were brave and forward-thinking, engaged with the University of Vermont Health Network, Elizabethtown Community Hospital, and entrusted to all of us the health of the Ticonderoga community. This was a big ask, and it was very future thinking, and we've done it, and it feels great to see this come together. It's really a tremendous story. I also want to thank, as always, Betty Little and Dan Steck, who have always been at our side and supportive, and have been great supporters of the network and the university and the communities they serve. Also, a deep thank you to John Remillard and Matt Nolan and their extended teams who, without their help, this would never have been possible. And then also internally, the Hudson Head Waters Board, including Peter Reel, who's here, but also Aaron Stiller, who's here somewhere, and Michelle and Maggie, Rich Valmore, Jim McCormick, and many others who really made this happen and did a lot of the work over the weekends and in the preceding weeks to get this accomplished. I also would like to acknowledge the partnership that we have with the Elizabethtown Community Hospital and, by extension, the University of Vermont Health Network. We have actually done a few health centers similar to this, the Champlain Family Health in Champlain, Plattsburgh Family Health, and now Ticonderoga. And there's definitely a steep learning curve involved with planning buildings that involve multiple entities. And we've gotten, I think, good at it over time, but one of the very best examples is the working relationship that we've had with John and his extended team here in Ticonderoga. So this practice is unique because the core of it has been part of Hudson Head Waters since 1992, currently serving about 4,500 residents of Ticonderoga and surrounding communities. They see here in this building, the providers, close to 11,000 patient encounters a year. And most recently have been seeing about 1,400 patients a month, which is really a remarkable service. The building also gives us an opportunity to expand. So we will have 4 additional exam rooms here, and we've gained some great momentum with the medical staff under the leadership of Dr. Salati and Dr. Mack to attract new providers with 2 new docs starting next summer, but also rounds out a group of very skilled and experienced PAs and nurse practitioners supported by a whole group of dedicated nurses and practice support folks. And it's really that team effort that enables us to provide care. And it extends from the frontline folks all the way up through the leadership at both organizations and the boards that support us. So as far as services here, this building is also unlike any other health center that we have built to date. It is state-of-the-art for sure, and providers will be able to do telehealth visits from most exam rooms. There's also things like printers in exam rooms, which are kind of unique because we can check patients in and check people out and provide patient education in the exam rooms. Space is designed in a team structure so that the providers and nurses are sitting close together. There is no playbook for this type of work. We've, I think, gotten pretty good at it over the years designing space, but this is truly a test and I think a great state-of-the-art design that will work really well. And what's exceptional about this building is how closely it's integrated with nursing home upstairs, but also the emergency room. We're sharing lab services, and we have been working really hard at the fun stuff, which is the integrated delivery service lines and filling in some of the blanks. So working very closely with David Klaus and others here to try to figure out what other specialty services could be needed, how to enhance things like gastroenterology and women's health. And that builds upon the work that we do day in and day out in family medicine, pediatrics, podiatry, nutrition, to name just a few. So this, especially in a rural community, is exceptional. And I think there are many, many towns across the country that would be envious of what we've created here. But it's only possible through the partnerships and also the tradition. There are a number of providers like Dr. Chapman and Dr. McKeever who carried the torch here for a very long time, many decades, who are rounding out their careers, including Jim Gabler and Rob Barrick, also PAs, nurse practitioners who have done extraordinary work over a very long time. And their job was really one patient at a time. Here, this next generation of providers will take on healthcare at a population level, which is pretty amazing, and that will include advocacy and problem solving, I think, for the broader community. So we should all be very proud of this and thankful. So with that, I'd like to hand it back to John.
Thanks, Tucker. In my first comments, I mentioned that when we started the planning process, we brought the New York State Department of Health to the table to help us with this transformation of this campus. They were a very important constituent because they regulate healthcare in the state, and they needed to buy into this concept first and foremost, that this made sense. And plus, we also needed them to provide us with the financial support to transform this campus. In both regards, we were able to convince them that this idea made sense and that it was worth the investment by the state of New York. I don't think we would have been able to successfully convince them without the help and tireless assistance and advocacy from Senator Betty Little. She was there all the way, helping us over the past 6 years, but really her help with this institution goes back decades. She was one of the people that originally convinced the regulators to designate this campus as a critical access hospital, which helped it financially for many years. But in the last 6 years, she's been our true support for this project. When I mentioned the hospital services that were rebuilt on the floor above, that was only made possible with a $9 million grant that she secured on behalf of the institution. And for this project here, we went back to the state and were able to get an additional $6 million to build these primary care offices, again, only with Betty's assistance. So we're very, very pleased that she's here today to participate in the celebration. But there's a little bit of sadness because I think you've all heard is that Betty's going to be retiring at the end of the year. So we will miss her advocacy, but we won't forget about all the great things she's done. Part of this project, around the corner when you come in the entrance, is a beautiful conference room that'll be used for years to come as a meeting space, but primarily an education space. The room is equipped with the latest technology so that our doctors and nurses on this campus can participate in educational programs from Burlington or other areas across the country. And when COVID subsides, we actually intend to make the space available for local community groups to have meetings up here, because a lot of not-for-profit communities don't have places to meet. The space is absolutely gorgeous, so I encourage you to all take a look at it before you go. And we find it fitting that we're going to name that space for Senator Betty Little. This will be one of the plaques that we'll have outside the door to commemorate that. So, Betty, thank you. Would you come up and say a few words?
Well, I guess I'm speechless, but I'll think of something, believe me. When John called me about this, and I said, I would never expect anything like that, and it's unnecessary, and I was just doing my job, and I like to stick to things to get what we want and what we needed, and I guess I did a lot of that, but that's part of the job. I mean, 25 years ago, this was a full-scale hospital, but they'd only had 13 births the entire year. And something had to be done because there weren't enough finances and there weren't enough services. And, nobody wants to go to a hospital for a surgery or something if they've only done 2 that year. So it just needed to have a change. And I can still remember sitting in that conference room with the board and the 6 people from the Department of Health. And don't write this down, but this was you know, we got to the end of this long meeting with everyone involved. Only one person was on the line, and we had all the players, and we had their consultants, we had everybody. And I was told that we'll think about it. And that was not the answer I was looking for. And I actually said off the top of my head, I'm not leaving this room until we make a decision here. So finally, when somebody said, well, would you leave the room while we discuss this? And I said, yes. So I went out and stood in the hallway. And the Department of Health was like aghast at me. So I went back in and they said, they talked it over and they decided, yes, they would go with the critical access hospital. And that's what really worked for a long time for all of us. So can't believe that was, somewhere in there 25 years ago. But, this is unique. And Tucker mentioned it. It'd be the envy of a lot of towns, a lot of rural towns. I mean, healthcare is so important to everyone, and it's all here, all in one place. I mean, you have everything here now. You have primary care, you have the hospital, you have the nursing home, you have senior housing, you have physical therapy. You have everything that is needed right here on this campus. And it's, as you said, state of the art. And I do believe that there aren't a lot of positive things that I can see coming out of COVID. But the one thing I can see is telemedicine. And especially for rural health care, I think people will get health care sooner than they would have. You don't want to go to the doctor, sit in the doctor's office, get all, and you can call and actually have a telemedicine call and get an initial, response from a physician as to where you are and what you're doing and move on from there. And that's going to be a huge benefit to everybody. But I love this place. I love this job. I am going to have a hard time finding something else to do. Although I played golf this morning at 7:45, so I'm working my way into golf, I guess. But it's just been such a privilege, and the thing I miss the most is all the people that I've worked with. And when I look around the room, I see them, and it's really hard. But naming something after me was not something I expected. And I said to John, what, the little conference room? It doesn't even make sense. So, but I thank you very, very much. And I know that Dan's going to do a great job. Dan's been involved since he became the assemblyman. If people wanted to come and see me, and they also wanted to see him, I'd say, let's do it together. And we had a little conference room in our little office, but and we would meet with people together. So we've been on the same page for a long time, and I really believe that will continue. But I can't thank you enough. I mean, it's an honor to have this job. It's been a privilege for all these years to know all you people and get some results. Not all the results we always wanted, but some results at least were good here. So thank you very much for this honor. I appreciate it very much. So, thank you.
Thank you, Betty. Assemblyman Dan Stack has agreed to say a few words. Dan?
Thanks. Well, good morning, and congratulations to Ticonderoga for a wonderful new facility. It's been exciting to see this develop over the last several years, and one of the things that I am going to miss is over the last 8 years I've been at a lot of events, and I usually am in the position of my remarks following Senator Little's remarks, and so that takes a lot of pressure off because I don't have to have something pithier or particularly intelligent to say. I just get to come up and say I agree with the senator, which is always true, but it wasn't very unique or interesting. But I will miss that. After 8 years of doing that, it's been a great honor of mine, professionally and personally, Betty, to run around the North Country with you and work on these projects and to learn from you and how your stick-to-itiveness and your work ethic, and of being able to push and continue to push to get where we're trying to get That's what public service is supposed to be about, and you were an ace at it your entire career. This is a wonderful facility, and one of the great anxieties that I know we all have in the North Country, myself included, anyone that represents anyone in the North Country, but among our neighbors, is access to healthcare. Over the years, and not through anyone's fault, other than an evolution of financial situation nationally and at the state level, the cost of healthcare. I mean, it's just we've evolved. People are living longer, and there's a lot more pressures to provide services. But yet, the changing economy and everything that's going on, it's moved a significant portion of the national economy in healthcare. And so we've seen consolidations and closures and a loss of access, and that's been very frustrating to people. And then it becomes a snowball effect, where people will leave an area for many reasons, but perhaps one's a job, perhaps another's family, but another one easily has been healthcare. So it's a beautiful place that we live in. We have an economy to worry about. We have a mill right up the road that employs a lot of people, and as the nature of manufacturing, they need to make sure that for their employees and their families, they've got access to good quality health care, both as an emergent level, but certainly as a daily routine. It's an important part of everyone's lives. And so to see organizations come together, and I heard Tucker say the word sharing and shared several times, and truly that's what's occurring here. But then the alphabet soup of all the hands that were involved in this project, all the different partners, it's encouraging to see perhaps oftentimes or in the past competitive entities collaborate together for the larger common good. And again, that doesn't happen on its own. That takes people to make that happen too, in their commitment. But it also takes leadership. And as Tucker pointed out, Betty has provided a lot of that for a long time of her distinguished career, and we're going to certainly miss that. But today is about congratulating Hudson Headwaters and the Tide community for a fabulous, brand new, state-of-the-art access for so many people in the immediate surrounding area. And as I said, when we opened the emergency department a couple of years ago, anytime I'm in the North Country, I'm in a healthcare facility, knowing all the driving that I do and all the outdoor recreation that I like to enjoy, I like to throw out to the healthcare providers as I run into them, O positive. So anyways, thanks everybody.
Thank you, Dan. When we started to plan this event several weeks ago, one of the first people we called, because we wanted to get on his very busy calendar, was Dr. John Brumstead, the president and CEO of the University of Vermont Health Network. And he planned to be here this morning, but his plans had to change about a week ago when Essex County was declared kind of a hot zone because of the outbreak here. Had he been here today, he would have had to return to Vermont and stay in quarantine for 2 weeks. So he couldn't be here, but I talked to him over the last couple of days, and last night he asked me to read some comments that he sent me. So I'm going to read them to you. Good morning. Unfortunately, the COVID pandemic has made it unwise for me to be at the opening of the Thai Health Center in person. Not being there in person in no way diminishes my passionate support of the rebirth of the Ticonderoga Health Campus as a true medical community. It takes the pandemic to keep me away. All involved, the Ticonderoga community, Interlakes Health, Hudson Headwaters, Elizabethtown Community Hospital, the University of Vermont, should all take pride in what we have accomplished. We now have sustainable access to healthcare services for the region. Primary care in a state-of-the-art facility provided by Hudson Headwaters, modern hospital outpatient services, emergency medicine provided in updated facilities by emergency medicine physicians from the University of Vermont Health Network, and we all have been a part of it. When the book of healthcare reform is written, the Ticonderoga community and what we have accomplished will be the chapter that stands out as how to get it right, how collaboration leads to a great outcome for all. Thank you, and well done, John Brumstead. And we're coming to a close here, so in a few moments I'll turn the microphone back to Tucker. But before I do, I did want to recognize a couple of organizations and individuals. The architects on this job are E4H, the engineers, Engineering Ventures, construction company, PC Construction, and Luck Builders. But on the campus here every day, the director of maintenance, Larry Lee, has been here overseeing it all and maintaining the rest of the campus and all of its activities and requirements. So it's been like an extra full-time job for Larry. He's the gentleman standing in the back. Wave your hand. Thank you, Larry. And likewise, Matt Nolan is the University of Vermont Elizabethtown Community Hospital's Chief Operating Officer, and we gave him an extra full-time job over the past year working on this project as well, in addition to his other duties. So thank you, Matt. And Jane Hooper and Elizabeth Rogers, we told them to make this a great event, but at the same time, you can't invite anybody because it's COVID and deal with all that. And they've done a great job. So thank you, Jane. Thank you, Elizabeth. And with that, I'll turn it back to Tucker.
Thanks, John. Just a few last comments. I think what you see here today is really a commitment to the community that has been a commitment that's long-standing but has a very bright future. Driving over to Ty today, looking down on the community, I thought, what a bright day for the town of Ty and surrounding communities. And I cannot think of a place better positioned for whatever the future may bring, even pandemics. So really, really proud of this and excited for what will be accomplished in the future as people work close together to solve problems. And lastly, two people that remain to be thanked include Rich Valmore and Jim McCormick, who are also hiding in the back, but have done all the technical work, wiring these rooms and seeing that we're in great shape. So thank you guys. And I knew you were here when I saw your truck, which is hard to miss. And to all of our virtual attendees, thank you very much for the time today. This is certainly unique, and we can't wait to see you in person. See you soon.